Hi, my name is Connor Ganser. I'm a physical therapist with over 5 years of experience treating patients who have gone under total hip and total knee replacements, all the way from day one post-op in their home to 6+ months down the line after surgery in the clinic. What I want to do today is start this series where I am specifically going to go over what you can expect after total knee replacement, the exercises you want to do, what your timeline of recovery should look like, as well as things to look out for. So today we're looking at expectations of what you can find after total knee replacement surgery. Surgery itself typically takes around 1 to 2 hours. And after waking up from anesthesia, you'll typically be greeted almost immediately by physical therapy, who is going to try to get you up, walking, and possibly doing stairs just to make sure that you'll be able to leave the surgery center or hospital safely and return home. Now, they also might be monitoring you for blood clots, excessive pain, infections, right? These are the things that most people who leave the surgery center the first day after surgery, same day. Sometimes if you have to stay a few extra days, these are the things that they're looking out for. Again, if your blood pressure is too high, you have a risk of blood clots, your pain is so much that you can't walk or do stairs, then that's where they may keep you the few extra days. But nowadays, most people are leaving the surgery center the same day that they get their knee replacement surgery. So say you do come home from surgery 1 to 3 days after surgery, same days from surgery, you want to make sure that you are able to get up the stairs if you have any to get into your house, move around, get into bed, or sleep on the couch. Have these things set up and planned beforehand, which, by the way, I have compiled a list of products that should be helpful for getting you around your home after knee replacement surgery in the description below. So if any of those products look enticing to you that you might think you'll have problems with, such as needing a shower chair, a raised toilet seat, which is a big one. If you have a low toilet, especially, a raised toilet seat is a lifesaver for getting on and off that seat after knee replacement surgery, or a foot strap for getting in and out of bed. These are the kinds of things to think about when you essentially have very limited use of your leg immediately after surgery. So that's the first 1 to 2 days after surgery. Also, during that time, you will typically be getting a call from a home health physical therapist. At least in my area, people tend to start with the first 2 weeks of physical therapy in the home, where your therapist comes to you, helps you move around the home, and also starts you off with some gentle exercises to get the knee moving and getting stronger. The first exercises typically come with just bending and straightening the leg, the very fundamentals, along with a lot of encouragement to walk, right? Along with that, your therapist will be monitoring you for big risk factors, again, such as blood clots, infections, excessive pain, things that they were looking out for in the surgery center. Your therapist should also be looking out for, because of things like swelling should typically be, or will typically be, increasing for the first 7 to 10 days after surgery. So you'll also be getting told that, aside from walking and exercise, that elevating and icing your leg are important to manage that swelling as it comes on. So that's an expectation. So get through that. That is typically the first 2 weeks in the home with your physical therapist after surgery. 2 to 4 weeks after surgery, you're looking at starting in the clinic of physical therapy most of the time. Sometimes you can extend your home health physical therapy if you're really struggling to move around and get out of the home, in which case it would be appropriate to keep going at the home if going to the clinic is going to cost you 3 hours a day and wipe you out completely, because you won't be able to maintain that amount of activity and it may set you back. So making sure that you're ready to transition to the clinic, typically around 2 to 4 weeks. This is the point where you're going to see some more mobility gains. It should be feeling smoother and getting easier to move your knee and feeling like you're stronger. This is also typically where you'll start to go up and down stairs at a normal cadence with using both legs. During the first 2 weeks, it's going to be usually 1 foot at a time. These are the kind of goals you'll be looking at. 4 weeks plus down the line, this is where you're getting more towards other personal goals. Now, especially if you're using insurance, it's important to continue going for medically necessary goals, getting in and around your house, doing ADLs, activities of daily living, things that you need to survive in physical therapy. But if you have further goals of, if you're into gardening and you want to get kneeling, those are longer term goals that include further knee healing as well as progression with your physical therapist to find a safe way instead of just going plopping that knee right down on the ground and without any regard for how that scar is healed, how the strength of the knee is looking, and the joint integrity itself after being replaced. So that is looking at 6 weeks down the line of surgery. Now, all this time, like I said, swelling typically increases for the first 7 to 10 days after surgery, but you want to be making sure that you're not overdoing it. So after that first initial 7 to 10 days, if you find another increase in swelling, that's an indication that you are overdoing your physical therapy, your activity, and you can probably scale it back a little bit. It may warrant another doctor's office visit, depending on how bad the swelling is. If it's slight, that can happen with exercise. If it's significantly puffed up and you've regressed in your motion, how well you can bend and straighten your knee, that would definitely warrant another doctor's office visit to possibly get some anti-inflammatory medication so that it doesn't affect you later down the line.